I'm Howard Lotsoff, president of NDA International. NDA International is the corporation which was specifically established to research and make available Endabuse, a highly purified form of ibogaine hydrochloride, as it is used in the Endabuse procedure to interrupt chemical dependency disorders. Endabuse has been shown to be highly effective in the treatment of opiate narcotics and stimulants. We at this time have 5 patents, one for the treatment of narcotic dependency, a second for the treatment of cocaine and amphetamine abuse, a third to interrupt or reduce the consumption of alcohol, a fourth to treat nicotine or tobacco dependency, and our most comprehensive patent for the treatment of polydrug dependency disorders in which the patient is using more than one category of drug at a time.
Ibogaine is one of 12 indoor alkaloids that comes from the Tabernacle iboga plant from Gabon, Africa. Basically, in its natural habitat, this plant grows to be approximately 3 to 5 feet. But the most the most important component of this plant is the root. The root is the source of the 12 indoor alkaloids. It's basically yellowish in color. Much attention has been focused on the ibogaine alkaloid because it is believed to be responsible for the psychopharmacological effects of the plant. The West Africans discovered the psychopharmacological effects of this compound back as far as 1864.
The development of a medical application is not simple. It requires both animal model research as well as human research. 3 scientists were important in establishing the animal model in order to allow us to proceed to human development. Dr. Stanley Glick, chairman of the Department of Pharmacology and Toxicology at Albany Medical College, provided information which showed 2 important facts. 1, that ibogaine would reduce morphine withdrawal, and 2, that it would substantially reduce morphine self-administration.
This was part of our initial study. Ibogaine was given 15 minutes before to rats that were trained to self-administer morphine intravenously. And as you can see, there was a dose-related depression of responding. In some animals, we found a rather remarkable decrease in drug intake that lasted for several days and weeks, and these are 2 individual rats. In other animals, there was no after effect a day later, or very little, and we gave ibogaine at weekly intervals, and sometimes we skipped a week. In these animals, sometimes we began to see long-term after effects after 2 or 3 injections of ibogaine. This is one animal that received ibogaine on 3 occasions, and it was only after the 3rd occasion that we began to see a long-term effect.
Dr. Patricia Broderick of City University of New York Medical School provided information which showed that ibogaine would limit the motor activity caused by cocaine, which appears to be so important in our ability to relieve the anxiety associated with cocaine detoxification.
The effects of the African plant, ibogaine, on cocaine-induced neurochemistry and correlative behavior in real time. This is what the behavior looks like after cocaine is given when the effects are not conditioned. You can see the immediate hyperactivity, the immediate central ambulation. When ibogaine is given in the presence of cocaine, we see here that the 1st hour post-ibogaine and the 2nd hour post-ibogaine, there is activity on the part of the animal. This is 40 milligrams per kilogram, given once a day for 4 days. And the animals, I would call this a weak stimulant effect, very, very weak. Not much more than saline, but certainly not immobilization. 1st hour post-cocaine, 2nd hour post-cocaine, 3rd hour post-cocaine, and 4th hour post-cocaine results show that there is a decreased dopamine induced hyperactivity in terms of locomotor activity by ibogaine when cocaine is present. And teasing out these behavioral parameters in this acute conditioned cocaine response, ibogaine significantly reduces the locomotor activity, does not produce any central ambulations whatsoever, and does not significantly reduce the rearing or the stereotypy. So it does have delineated effects on the behavioral parameters.
Dr. M.R. Jolik of Erasmus University Rotterdam initially showed in his work that ibogaine would reduce morphine withdrawal, and then later went on to show that ibogaine would substantially reduce the self-administration of cocaine long after the ibogaine itself was absent from the body.
Still, I selected 3 slides in which I consider I may show some aspects of the inhibitory effect of ibogaine on cocaine intake, which may be well of interest for future investigation. Here you may see the effect of the ibogaine administration, single administration of ibogaine in the cocaine-addicted rats. However, a very profound decrease in the cocaine intake has been observed after pre-treatment, half an hour before session, with 40 milligram per kilogram of ibogaine. These results, we have performed an experiment in which we gave the ibogaine in 3 consecutive days. So you may see that here, after the first injection of ibogaine and after second injection, this means on the second day and the third day, the profound decrease of the cocaine intake has been observed. And in the third type of the experiments, while we were injecting the 3 consecutive concentration of ibogaine, but not on 3 consecutive days, but in the beginning of each consecutive weeks. This decrease of the cocaine became after the second administration of the ibogaine also evident, and even more, the decrease of the cocaine consumption was also evident and present during the weekend, in spite of the fact that we didn't measure it. But in the Monday and on Tuesday in the following week, well, we have seen a decrease of the consumption of the cocaine. With the third injection, this effect was even more pronounced, with the same long-lasting effect in the following week. That's maybe it's an important point, particularly in the future investigation, showing that repetitive administration of ibogaine might have more pronounced effect. It's worthwhile to have this in mind, particularly in the situation when the one dose is, well, in patient eventually or in the animals is not effective.